What do we do when a patient tells us something that's different than what they documented on their medical history?
Find out today on Medical History Mysteries.
We are continuing our conversation about dental professionals are humans too. And today I want to talk about when patients contradict verbally what they've written in their medical history. Now, I have an example for you. It happened to me, actually. I had a patient that in their medical history disclosed an allergy to penicillin and then called me on the phone saying that they were having pain in their mouth and they wanted a prescription for amoxicillin. And I said, I can't write you a prescription for amoxicillin because you have disclosed on your medical history that you have an allergy to penicillin. And they said, yeah, no, it's fine. I can take amoxicillin. It's fine. I can have that. I'm not even sure if I have an allergy, but I said, but it's written in your chart. I really am uncomfortable. And this was a new patient. So this wasn't like somebody I've known forever. This is a new patient. And so I felt really kind of cornered by the patient because they were pretty aggressive in their seeking this prescription, but their medical history contradicted what they're telling me verbally. What do we do now? Who wins, verbal or written?
This is probably one of the most complex problems I've ever faced when dealing with patients and their medical history, because many times I will have taken the medical history 3, 4, 5 appointments ago, a year ago. They tell me something that I know is lifelong, like an allergy, only to then later on say, no, no, I was wrong about that. I don't have that allergy. Or no, I was wrong about that. I really didn't have that procedure done. Or no, no, did I say that my appendix was removed? No, no, I still have my appendix. Yikes. So what do you do when a patient contradicts the very information they've given you previously? The best you can do is realize that whatever the patient's telling you at the moment is worth what it is at face value, which is how do you know that they're not forgetting something from the past? So they had more clarity or they had better recognition in the past, but now they may not. This could border on things like substance use and abuse. It could border on things like getting older and having, less vivid memory. It could even fall into the realm of maybe slight dementia. Whatever it is, the medical history is what it is. You ask the patient all the time, any updates, any changes? Because things can change, but some things can't change. So what do I do in this situation? The guy tells me he's got a penicillin allergy. Now he wants amoxicillin. Okay, I would say that allergies are the biggest enigma for us to deal with because people believe they're allergic when maybe they're really not. There was a study that was published that said there's, up to 40% of people believe that they're really allergic to penicillin mistakenly. They're not. Okay, now why would someone believe they're allergic to penicillin? Let me give you some things I've heard. Okay, I'm allergic to penicillin. What makes you think so? My mom was. Okay, it's not hereditary. I'm allergic to penicillin. What makes you think so? My wife is. Okay, it's not contagious. I'm allergic to penicillin. What makes you think so? It makes me go poopy. Yeah, you and the rest of the world. So you can say you're allergic, but is it really, something you heard through the grapevine, something that you believe is true but really isn't, something that was an adverse reaction, but you viewed it as an allergy? So I think the first thing to do in this situation is before we write down a patient's allergic to anything, we verify what they mean when they say, I'm allergic to. Okay, you say you're allergic to penicillin? Tell me everything. What happened? I took the amoxicillin and ended up in the ER that night and I almost died. Okay, you're allergic. But other than that, I want to know all the details because I need to make the determination. If it means I need to call your medical doctor, if it means I need to call your pharmacy, whoever, I'm going to find out and get some information that backs up what you've said. But now, once you've told me and I verified it, it's really hard for you to go back later and say, no, I was just kidding. Do allergies change? No, as far as I know. Now, let me give you a personal story from me, okay? When I was a kid, I had a procedure done and I was given contrast dye. and I broke out head to toe in hives. So my entire life, I've been thinking, well, I've got an allergy to iodine, not realizing that I've taken iodine doses in seafood and other things all these years, never got anaphylaxis, only to realize later now that all these years I've said no to contrast dye, no, I can't have contrast dye. Now I find out that there is no iodine in some contrast dyes. There's iodine-free contrast dye. So can I have contrast dye? Yeah. And every time I go to get a procedure done, oh, you can't have contrast dye. You wrote that down here. Okay, but things have changed. So it's important to realize when things do change. I'm going to say as a penicillin allergy, that kind of thing, that never changes. I think that's the way it is. And then again, you may decide, look, I don't even want to have the argument. If somebody really wants me to give them amoxicillin, and it clearly says on their chart that they are allergic to penicillin, and I don't really have any options, I'm just going to prescribe them azithromycin and say, as clearly as I can, I think this is a better choice for you. And just move forward that way. If you can, sort of bob and weave here and say, okay, I really don't want to prescribe the amoxicillin. Let's not have that discussion. Let's go this way. Are there going to be patients who insist on the amoxicillin? Probably. What do you do then? My advice is you stand your ground and say, look, I know what you're saying, but in this situation, I'm just going to prescribe you azithromycin and we're going to move forward. You may not want to have that conversation. You may not want to risk losing that patient, but then again, you may not want to risk giving that patient something that they're allergic to. They get the anaphylaxis, they end up in the ER, God forbid they die, and then it's your fault because all over the chart it says, this patient's allergic to penicillin. Why'd you give them amoxicillin? Well, they told me they weren't. I wouldn't put my future on that one.
Definitely not. And that's what I did. I went with the take it or leave it. You get azithromycin or you can call somebody else. And guess what? They took azithromycin and they lived to see another day. So life is good there. So once again, always before you write a prescription, double check your medical history. I always ask my patients when they write that they have an adverse reaction to any medication, what happens? I had one that said they got one hive as a kid, and they're taking that as a lifelong allergy. And I said, good enough for me. I won't be prescribing it for you. I don't know, it's in your chart as hives. So that's what we're going to do. So it sounds to me that if we're looking about protocols or things we should do in our practice, the written word trumps the verbal word. Is that right?
And again, and reach out to your partners. If you really feel you're confused, call their medical doctor and say, the guy's telling me he's not allergic, but I have it in my chart. Oh no, we found out that was incorrect. Great, get it in writing and slap it in the chart. Say, okay, your medical doctor told me we were wrong about this and we've updated your history now. So yes, we can feel confident prescribing amoxicillin. But don't just take the patient's word for it. As you and I have said many times, patients are their own worst reporters of their own medical history.
Most definitely. And another opportunity for collaboration with your local physician. So great advice. And thank you for that.
Thanks, everybody.